According to the Ministry of Health, the treatment is expected to improve the handling of COVID-19 patients. Unveiling the treatment at Makerere University, Health Minister Dr. Ruth Acheng said the rapid spread of the virus in the population had necessitated a shift in treatment regimes.
The convalescent plasma study and to direct the scientists to begin the clinical trials tomorrow for God and my country.
A total of 162 COVID convalescent plasma units have been collected from willing donors. Only 125 units are visible, however, and will be used to treat 65 patients. Each patient requires 2 units of plasma.
We still do not know whether it actually, the convalescent plasma will actually be efficacious in treating COVID-19. So that is the next step. We want to find out if a patient has COVID-19, mild, moderate, severe disease of COVID-19, and they are treated with this convalescent plasma in a dose of 200 mils twice, that comes to 400 mils, do they actually recover from COVID-19?
The plasma is from people who have recovered from COVID-19 and may contain antibodies to fight the disease. The ministry has urged more recovered patients to donate plasma for the clinical trials. According to Dr. Bruce Chilenga, the principal investigator in the use of COVID convalescent plasma has an investigational drug. Upon recovery, people who have suffered from COVID-19 develop antibodies, and it is these antibodies that are being used to treat those who are sick. He said there is evidence that when the plasma is administered to the COVID patient, it blocks the progression of the disease to form severe form.
Science is simple. Now, how does the plasma work? What we are saying is that when you get infection, you make antibodies. And those antibodies, they go and attack the infection and neutralize it. And that's how we heal from these infections. Now, what we are doing is we are getting these antibodies from healed people and give them to this person who have not yet made his own antibodies and neutralize the virus in real time. And where some studies have been done, there is dramatic improvement in symptoms when these antibodies are given. So you neutralize the virus in real time. So that's the science we are trying to do. The other way to make people get antibodies is actually through immunization, vaccination. We introduce a bit of the virus or part of it so you can make antibodies in your body to keep when you get an infection. So for this, it's just getting ready-made antibodies, put them in this person, so that you can neutralize the virus on their behalf until when they make their own.
Uganda becomes the 3rd African country to use convalescent plasma in the treatment of COVID-19 after Ghana and South Africa. Uganda had registered 5,123 COVID patients by the press time. Dr. Ruth Acheng challenged Ugandans to observe the standard operating procedures on COVID prevention as scientists are trying their best to find a lasting solution.
COVID-19 has no treatment. What is given currently is supportive. So having convalescent plasma come on board is great, and we are looking forward to it being started tomorrow. Can you start the clinical trial tomorrow?
Sarah Nakandi, STV Select News.